When a life is on the line, minutes matter. First responders encounter that each and every day. A Northern Michigan lawmaker, a first responder himself, says our current laws could mean those valuable minutes may be lost when they don't need to be.
There's advanced life support ambulances are a miniature version of, an ER.
A mini emergency room on wheels. At Green Lake Township Emergency Services, their ambulances and their highly trained crews inside are equipped and trained to handle the most serious of medical emergencies.
At minimum staffing, you need to have a basic EMT and a paramedic. So that would be an advanced life support.
And that advanced life support is what they offer here and at most larger departments, but smaller ones aren't always at that level.
Some services have basic life support, which requires a medical first responder and an EMT, and those are to transport patients.
The big difference you might notice in a medical emergency, advanced life support rigs and crews can do a lot more to save your life.
Paramedics do cardiac monitoring, EKGs. They carry quite a few more medications, like cardiac medications for folks having heart attacks, for having a cardiac arrest.
Earning that advanced life support status and the ability to do all those things under current Michigan law requires that a department have that advanced level of staffing always.
24/7, 365 is, somebody's always got to provide that response.
And State Representative Dave Preston,
still licensed to this day as a paramedic,
has an issue with the current rules that fully trained paramedics can't do all they can because their departments can't provide that level of around-the-clock service.
As a paramedic, when you're rendering aid at a BLS level and are unable to use your advanced skills, it's incredibly disheartening and it costs patients' lives.
So he's introducing House Bill 5249 in Lansing.
This bill that I'm going to introduce is really going to allow some of these BLS units that if there is a paramedic and an EMT on that rig, and that rig has been licensed to restricted ALS, that they're going to be able to work to their level of their scope of care.
So if a smaller department running basic life support most of the time happens to have a crew with a trained paramedic some of the time, they could at least offer a restricted advanced life support level of care when that crew member's working, bringing care to the patients instead of having to wait to get the patient to the care at the hospital.
In rural areas, it's going to save lives. At the end of the day, it's going to save lives.
By allowing the paramedics to treat patients in an advanced life support method, Representative Preston says they will arrive at the hospital in better shape. And those ambulances may not have to run emergent with lights and sirens, since treatment can actually begin on the road. And that is safer for not only the patient, but for other motorists on the road as well.